Hi, you guys. Welcome back for our daily practice questions. It is day 89, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And if you're looking to join the upcoming 5 week intensive review, grab the last space by clicking the link in the description. All right, question number one. A 5-year-old child presents to the clinic with erythematous sores around their mouth and nose. The lesions have a honey-colored crust over them, and the child has mild itching. The mother reports the child has been scratching the affected areas, and the sores have been present for a few days. The child's temp is 99, and they appear generally well. What is the most likely diagnosis for this child? Is it A, impetigo, B, herpes simplex virus, C, chickenpox, or D, contact dermatitis? Take a moment and tell me what you got in the comments, y'all. All right, you guys, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here, the stem of the question states, what is the most likely diagnosis for this child? All right, and I always tell you, if they're asking for a diagnosis, you need to run it back and look at the assessment findings, being what are the signs and symptoms? What are their chief complaint? How are they presenting? What is noted on exam? And I always tell y'all also three things if these are provided to pay attention to in the assessment. What is their age, their gender, and ethnicity? Because this can aid in determining a differential diagnosis as well as how to treat, right? So in this scenario, we have a 5-year-old child that comes into the clinic. Mom brings it in. This child has erythematous sores around the mouth and nose. And then the lesions have a honey colored crust over them, and the child has mild itching. Does have a low grade fever, and the mom states the child has been scratching those areas. Y'all, this is one of those scenarios where there's a key identifier in the presentation, right? And I always tell y'all know those key identifiers because when I say this, you say that, so to speak, right? So when I say honey colored crusted areas or lesions, you say impetigo, right? So the best answer is A, impetigo. All right, question number two. A 30-year-old patient presents with a circular red rash with a clear center and a bullseye appearance. The patient reports a recent tick bite during a hiking trip. What is the most likely diagnosis? Is it A, psoriasis, B, erythema migrans, C, tinnitus corporis, or D, pityriasis rosea? Take a moment and tell me what you got in the comments, y'all. All right, same thing. Always look at that stem of the question first. So, stem of the question states, what is the most likely diagnosis? So, again, we're going to run it back and look at those assessment findings. So, we have a 30-year-old patient comes in with a circular red rash with a clear center and a bullseye appearance. The patient reports a recent tick bite during a hiking trip. All right, y'all, key identifier. When I say bullseye pattern, what do y'all say? Lyme disease, right? But I gave you a twist in this because I also need you to know all names, right? Either way they present it, however they provide it to you, I don't want you missing things because you're able to walk through and say, bullseye pattern rash, I know that's Lyme disease, right? But then you look on here and you don't see Lyme disease as a option or an answer choice, right? Also know that Lyme disease is also known as erythema migrans. So the best answer is B. I want you to know it. I don't want you to, kind of remember and then you're questioning if that is the same one or you're doubting yourself because of these things. So when you study, this is what I mean by studying completely full circle. As you walk yourself through, do the signs and symptoms. Think, as I always say, assessment, diagnosis, evaluation, and treatment. So when you know the diagnosis, when you say Lyme disease, you need to say Lyme disease, aka erythema migrans. Study it together like that every time. Call it that every time so that you're not missing it when you run into scenarios like these. All right, and lastly, question number 3. Which of the following is a characteristic feature of pityriasis rosea? Is it A, a hero patch followed by a rash in a Christmas tree pattern on the trunk? Is it B, a butterfly-shaped rash across the cheeks and nose? Is it C, multiple fluid-filled blisters on the extremities? Or is it D, thick silvery scales on the scalp and elbows? Take a moment and tell me what you got in the comments, y'all. All right, so here the STEM is the question. The question is the STEM. This is a more knowledge-based question. But which of the following is a characteristic feature of pityriasis rosea, right? And the best answer is A. You know, that hero patch typically presents and then it's followed by that Christmas tree pattern rash on the trunk. And on the trunk is specific because and important. And when I say on the trunk, this can be front, back, you know what I'm saying? And I say that because I've had that question with one of my review students. But I say this because y'all know I tell y'all all the time with derm, location, location, location is important. Because on the exam, majority of your questions are paragraph scenario based, right? So if they give you a scenario and they're saying, a Christmas tree pattern rash is noted on the trunk. Or if they show you an image of a derm disorder and they show you a patient's trunk, this should start to put you in the mind of differential diagnoses that are found on the trunk more commonly, right? Herald patch, Christmas tree pattern rash, those are key identifiers for pityriasis rosea. But while I have you, let's talk about these other ones just for a little extra, right? So a little bonus recall. So B says a butterfly shaped rash across the cheeks and nose. What is that, y'all? What do you think about with a butterfly shaped rash across the cheeks and nose? Tell me in the comments. You should think lupus, right? Butterfly shaped pattern rash on cheeks and nose, lupus. C, multiple fluid filled blisters on the extremities. That's more of this may be one that you don't commonly see or hear, but I threw it in there. But it's like the bullets in Impetigo. And then D, thick silvery scales on the scalp and elbows. When I say silvery scales, what do y'all say? Psoriasis, right? So things like this, I want you to be able to quickly identify, quickly associate, and be able to run it back. When I say silvery scales or plaques, you say psoriasis. When I say herald patch or Christmas tree pattern rash, you say pityriasis rosea. If I say honey-colored crusted areas or lesions, you say impetigo. If I say butterfly-shaped rash, you say lupus. If I say bullseye pattern rash, you say Lyme disease, erythema migrans, right? I want you running it just like that because these should be ones that you get every time and don't lose points or give the test any points because of skipping over those little details or forgetting the key identifiers, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I do offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, custom packages or plans, or question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.